Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into top 5 tips for managing diabetes in pregnancy. You'll discover practical, mom-friendly ways to keep you and your baby safe while managing gestational diabetes. Whether you're newly diagnosed or just want to be prepared, these tips will empower you to take control of your health. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. This causes blood sugar to rise. If not managed, gestational diabetes can lead to pregnancy diabetes risks like a larger-than-average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Today, we're sharing the top 5 tips to help you navigate this condition with confidence. Tip 1. Get tested and monitor symptoms. Early detection is key to managing gestational diabetes. If you're feeling thirstier than usual, even after drinking plenty of water, it could be a sign of gestational diabetes symptoms. High blood sugar makes your body flush out sugar through urine, which dehydrates you. You might also notice frequent urination, beyond what's normal in pregnancy. Waking up multiple times at night to pee is a red flag. Fatigue is another clue. If you're exhausted despite resting, your body might not be using sugar effectively for energy. Blurred vision can happen too, as high blood sugar affects the fluid in your eyes' lenses. Lastly, genital itching or frequent infections like yeast infections can occur because high blood sugar creates an environment where bacteria thrive. If you notice these, talk to your doctor right away. They'll likely recommend a gestational diabetes test, usually between 24 and 28 weeks. This test involves drinking a sugary solution, and they check your blood sugar after an hour or two. Keep a journal of your symptoms, like how often you're thirsty or what you're eating, to share with your doctor for a better diagnosis. Tip 2. Follow a gestational diabetes diet. Eating for gestational diabetes means choosing low-glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. Aim for smaller, balanced meals every few hours to avoid blood sugar spikes. For example, pair a complex carb like quinoa with a protein like grilled chicken and a non-starchy vegetable like broccoli. Avoid sugary drinks like soda or juice, and stick to water or unsweetened teas. The Centers for Disease Control and Prevention suggests keeping carbs to about 40% of your daily calories. A dietitian can help you create a personalized gestational diabetes diet plan. They'll consider your weight, activity level, and pregnancy stage to ensure you're getting enough nutrients for you and your baby. Tip 3. Stay active with safe exercise. Exercise helps your body use insulin better, lowering blood sugar naturally. Walking for 20 minutes a day after meals can make a big difference. Prenatal yoga or swimming are also great options for most pregnant women. Just check with your doctor first. The American College of Obstetricians and Gynecologists recommends at least 150 minutes of moderate exercise per week, spread out over several days. For example, you could do 5 30-minute sessions of brisk walking. Exercise also reduces stress, which can affect blood sugar. Start small if you're not used to it. Try a 10-minute walk and build up. Always listen to your body and stop if you feel dizzy or short of breath. Staying active not only helps manage gestational diabetes, but also boosts your energy and prepares you for labor. Tip 4. Monitor your blood sugar regularly. Your doctor may ask you to check your blood sugar several times a day, like before and after meals. This helps you see how food, exercise, and stress affect your levels. A glucometer, a small device that pricks your finger, is easy to use at home. Normal blood sugar targets for gestational diabetes are usually under 95 milligrams per deciliter before meals and under 120 milligrams per deciliter 2 hours after eating, but your doctor will give you specific goals. Keep a log of your readings to spot patterns. For example, if your blood sugar spikes after eating pasta, you might need smaller portions or a different carb. Regular monitoring empowers you to make smart choices and keeps your doctor informed. If diet and exercise aren't enough, your doctor might prescribe insulin or oral medication to keep your levels in check. Tip 5. Stay hydrated and manage stress. Drinking enough water is crucial for managing gestational diabetes. High blood sugar can dehydrate you, so aim for 8 to 10 cups of water daily, more if you're active. Carry a reusable water bottle to make it easy. Avoid sugary drinks, as they can cause blood sugar spikes. Stress can also raise blood sugar by triggering hormones like cortisol. Try relaxation techniques like deep breathing or meditation for 5 to 10 minutes a day. Prenatal yoga, as mentioned earlier, doubles as a stress buster. Connect with supportive friends, family, or a counselor if you're feeling overwhelmed. Joining a gestational diabetes support group, online or in person, can also help you feel less alone. Managing stress and staying hydrated are simple but powerful ways to support your health. Let's bring these tips to life with a story. Meet Emma, a 30-year-old mom in her second trimester. She noticed she was thirstier than usual and thought it was just pregnancy. But when she started waking up 3 times a night to pee and felt exhausted despite resting, she told her doctor. They ordered a gestational diabetes test, and Emma was diagnosed. She worked with a dietitian to create a gestational diabetes diet, choosing low-glycemic meals like quinoa with veggies and grilled chicken. She walked 20 minutes daily and checked her blood sugar regularly. Emma also drank plenty of water and practiced deep breathing to manage stress. By delivery, her baby was a healthy 7 pounds, and her blood sugar was under control. Emma's story shows that taking action early with these tips can make a big difference. You can take charge of your health too. To wrap up, today we covered top 5 tips for managing diabetes in pregnancy. You learned how to spot gestational diabetes symptoms, follow a gestational diabetes diet, stay active, monitor blood sugar, and manage hydration and stress. These steps empower you to protect your health and your baby's. We're here to support you with clear, reliable advice for a healthy pregnancy. Comment below. Have you noticed any gestational diabetes symptoms or tried these tips? Let us know. Subscribe for more videos on gestational diabetes management, diet, and pregnancy diabetes risks. Check out our playlist on gestational diabetes for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video. Disclaimer: this video is for informational purposes only and not a substitute for professional medical advice. Always consult your doctor for personalized guidance on managing gestational diabetes.